So I guess we should start by looking at why do you need software? We know that care businesses across either care homes, home care, etc., you don't necessarily want software, but you do need it. And so there's a couple of reasons why you should be looking at making a switch to digital platforms if you haven't got any, or looking around at other offerings if you have got something already. The idea is that software like ours and other platforms on the market will help you save time, reduce administration, and improve your efficiency across your business. And that doesn't necessarily mean that you have to be looking at how much profit that you're making, etc. It means that you could be spending more time with your staff, focusing on better quality outcomes, etc. It's allowing you to increase your capacity through giving you better visual indication of where you've got gaps, where carers' utilization isn't necessarily 100%, and makes processes like rostering and other things that you might do within your business, management of training, qualifications, etc., more efficient. Hopefully, these packages will help you minimize travel time. Of course, this differs obviously in a care home, but particularly in a home care setting, minimizing that travel time becomes important. So there's more contact time with clients, increases your productivity, and helps you automate processes such as invoicing and payroll. You will not find, as far as I'm aware, a package that replaces additional software in payroll and accounting spaces. But what we can help you do, and what other packages will help you do, is integrate with those other systems to make your processes easier and simpler. One of the things I really love about the stuff that we do, and I know other people do things like this as well, is improving communication between not only the carers but also with service users, friends and family, etc. So what we're finding is things like by allowing family members to access schedules, to access their rota information and see that visits have been attended and maybe some photos during tasks, etc., they're able to communicate better with the service user rather than conversations continuously coming back through the care business. And that's reducing the noise that you're experiencing and actually improving communication between service user and family member. And then the communication that you have with the carer becomes better as well because they've got more information at the touch of their fingertips. Obviously, that helps because everything's all in one place. So it's reducing your paperwork and your filing, reducing errors and transcription issues through the electronic MAR charts, etc., and of course increases the accuracy of information. But really importantly for everybody, it's a heavily regulated sector. By having platforms like this in place, you're able to evidence compliance, etc., much easier. One of our customers that we work with, North Shropshire Home Care, the deputy manager that's there said that she didn't realize how difficult paper-based systems were until they went digital. They've got more time to be focusing on management, admin and auditing, and our platform has cut a lot of processes down by at least 50% for them. And of course, as I said earlier, by having something like that, they're able to take on more packages. There are, though, a huge number of systems to go and look at when you're making a decision like this. From the research we've done, we think there are around 40 different home care management solutions in the UK, some of varying degrees of how much they look at patient welfare in terms of medication, in terms of observations, etc., and how much they focus more on running your business for you. Some are low cost. There's not, all these extra bits that platforms like ours offer. And others claim to be integrated all-in-one solutions, but in reality, it's a series of connections between different platforms. So what do we think you should really be looking at from our experience?